Hi everyone, this is Dr. Hall, and we're going to continue on with non-hormonal contraception. Specifically, in this section, we're going to talk about non-hormonal methods that can be controlled by the female-bodied partner. So first, let's talk about barrier methods. So a barrier method means basically that you're creating a physical barrier or a wall between the sperm and the oocyte. So therefore, you're preventing fertilization. So the female condom would be our first example of a barrier method. So this is basically a tube made out of polyurethane, and there is an inner ring at the closed end of the tube that gets squeezed here and then inserted up into the vagina. That upper ring helps hold the female condom in place. Right, so you have basically this sheath of polyurethane that lines the entire inside of the vagina, and then you have an outer ring that stays outside of the body kind of as an anchor, right? So then when you have intercourse and the penis then goes inside this polyurethane tunnel, any semen that's released cannot get up inside the cervix and the uterus. So these work pretty well. They take a little bit of savvy to learn how to use, but so do male-bodied condoms. Sometimes it's almost a better term to say this is an internal condom, because not everybody with a vagina identifies as female. But they work pretty well. They're relatively expensive, usually about $4 each, which is more expensive than an external condom or a penis condom. They also sometimes can be a little noisy, I've heard from some folks, and it also, you want to be very sure to not use this with a penile condom at the same time, because the two condom materials rubbing against each other, increased risk of friction and breakage. So you definitely don't want to use that. One or the other is what you want. So this is, again, all of that information. Nice thing about these, of course, is that they are also protective against STIs, against sexually transmitted infections, as well as against pregnancy. Another option for people with vaginas is to use a diaphragm or a cervical cap. So a diaphragm is shown here on the upper left. It's a big dome made out of latex with usually kind of a spring-loaded ring that you can squish to insert, and then you put it in place. Now, unlike the vaginal ring, which is the hormonal contraceptive, this one you have to make sure that it covers the cervix, right? This is a physical barrier. So this takes some time and some practice. So when I fit these in the office, and they do have to be fit, they come in different sizes, it usually takes the person about 45 minutes to an hour to learn to be able to accurately place and remove the diaphragm when they're first learning how to do it. Another thing I want to point out to you is this here. This is spermicide. So just because there could be a little potential gap around the edges for sperm to get in, you have to also place spermicide all around the rim of the diaphragm, just to ensure a good seal. A cousin to the diaphragm, but a bit more advanced for users, is the cervical cap. You can think of it like a mini diaphragm, and instead of being a big dome, it's a more fitted dome that is going to cover the opening to the cervix. So this one's going to require an even more savvy user because you have to make sure to get it just in the right spot so that it is covering the cervical opening. For that reason, cervical caps tend to be less popular than diaphragms, but I've certainly met some people who are devoted users. Also, it's kind of a weird image here. Normally your hand would be the other way because usually you're inserting it from the front. But anyway, so this is more information about the diaphragm. And so it's really important to know that you insert it before intercourse, right? And then you need to leave it in place for at least 6 hours afterward, right? Sperm can swim, right? So you have to use it with spermicide and then let it all sit there for 6 hours. Give time for the sperm to all be killed off by the spermicide before you remove the diaphragm, because otherwise then the sperm would just swim up later. One other thing to point out about diaphragms is that occasionally this part towards the front here can push on the urethra, which is located towards the front, right? So you have your bladder here and your urethra. And so sometimes it can cause some bladder or urethral irritation. Again, here's the cervical cap. It's just a smaller version of a diaphragm, and so you have to be an even more savvy user to use that properly. Another barrier, which is also kind of a spermicide, is the contraceptive sponge. So this is literally a spongy material. You can buy these over the counter. Actually, sometimes they're on the market, they're off the market. I'm not sure if they're on the market right now. And they've been impregnated with a spermicide. And so what you do is you run this kind of dry sponge underneath the sink, get it wet, and that activates the spermicide and makes the sponge soft. And you insert it like you're inserting a diaphragm. So this is kind of like a different version of a diaphragm, again, creating a physical barrier to prevent sperm from getting up inside the uterus. Because it's not fitted and because a physician hasn't checked to make sure you know how to put it in the proper place, these are associated with a higher failure rate. These are less effective than than a diaphragm or a cervical cap. So if we look at the effectiveness of the diaphragm and the sponge together, we're going to see a couple of different things. So first of all, the sponge is listed here, and you'll see they have broken it out into two categories: parous women and nulliparous women. So the difference here is a parous woman is someone who has given birth before, which means it's someone whose cervix has been stretched to 10 centimeters before, typically, whereas a nulliparous woman has never given birth before, and so her cervical opening is going to be smaller. So you're going to be more effective at preventing sperm from getting up through the cervix in someone who is nulliparous, especially with a sponge where it's not as closely fitted. But you can see really high failure rates even in perfect use for people who've had babies before. And if we look at typical use effectiveness, certainly better than nothing, right? So no method is up here. And if you don't use any contraceptive at all, there's an 85% chance you'll get pregnant. So these methods will significantly reduce your risk of pregnancy for sure. They're just not as effective as other options that we have. So the last two that we're going to talk about for female-controlled non-hormonal contraceptives are spermicides and fertility awareness-based methods. Spermicides are what they sound like. They are cidal, as in like homicidal, they are killing of sperm. And they come in lots of different formulations. So it can be a foam that you kind of spray into the vagina or insert with a syringe, or a suppository, right? It looks like a little tampon and it just kind of dissolves inside the vagina, or the film, right? This is like those medicine films that you can like just put in your mouth and it dissolves, same kind of concept, but it's a film you put in your vagina that dissolves, right? Or a gel, all different types of things you can do that you insert into the vagina. The problem with spermicides is that they're not very highly effective. So if we look at efficacy data, we see that even with perfect use, 18% will still get pregnant, and with typical use, almost 30%. Still better than nothing, but not highly effective, less highly effective than most other methods. The other thing about spermicides is that they can also increase your risk of getting STIs by causing some irritation of the mucosa inside the vagina or on the penis. So they can be irritating and increase susceptibility to infections. So in general, we don't recommend spermicides as a method you would use regularly. If it was in a pinch and it was this or nothing, then yes, absolutely use a spermicide. So yeah, they have a place if you happen to have them around and have nothing else to use. All right, so fertility awareness-based methods are really interesting. They go by lots of different names, so the rhythm method, periodic abstinence, the calendar method, and there's a lot of different subtypes of this method, and they all have differing effectiveness. But the unifying principle here is that you are going to pay attention to your natural menstrual cycle so that you are aware of when you tend to ovulate. Then you can avoid having intercourse in the days leading up to ovulation, right? Because sperm can live for several days, and for a few days after ovulation. So this means that what your plan is you're going to figure out when you are fertile, when you are at risk for getting pregnant, and then you're going to abstain from sex, usually for around 7 to 10 days out of each 4-week cycle. So this can be effective in some really highly motivated people because you usually have to keep track of a lot of different data points. So you're not just tracking your periods, you're also tracking your basal body temperature or the consistency, oh, hi Kat, of your cervical mucus, right? You're going to be keeping track of lots of different types of data to have a really good idea of when you are actually at risk for pregnancy, when you are coming up to the time of ovulation, and when you have ovulated. So it can be a really nice way to get in touch with your body, but it's difficult for a lot of people to do this method well. This is the one form of birth control that is allowable by the Catholic Church. So they're okay with people using this method because they feel it's just natural, whereas other forms of contraception are actually forbidden by the Catholic Church. This is a little bit more detailed information if you want to pause and take a look at that. And so before I move on, though, I will say if you are someone who does not have regular and predictable cycles, then you are not somebody who ovulates regularly. And so these methods can be more prone to failure because you're not in that regular, predictable pattern. Because remember, you can get pregnant if you have sex in the days leading up to ovulation. So you need to be able to predict that with some good reliability in order for these to be effective. So when we look at the effectiveness of fertility awareness-based methods, typical use effectiveness is not great. So still better than spermicides, but about 25% of typical users will get pregnant within a year using a fertility awareness-based methods. Now there are some users who are really good at doing this perfectly. And so if you do this perfectly, the efficacy is up in the mid-90s, right? So that's better than, for example, the sponge or the diaphragm, but it's not as good as some other methods. So this has a place, but it's not widely recommended. So in summary, female non-hormonal methods include barriers such as the female condom or internal condom, or the diaphragm or cervical cap, placing a physical barrier between sperm and the oocyte. Spermicides can be effective by effectively killing the sperm, but they're not as effective as some of the other methods we've discussed thus far. Fertility awareness-based methods require periodic abstinence. They require you to not have sex during those times when you are potentially at risk of conception, and require you to keep track of a lot of data. So for very motivated people, they can work quite well, but in the general public, it's not usually their best bet. So we'll pick up next time talking about male-bodied controlled methods of non-hormonal contraception.